También entrevistamos al Dr. Simoneau, quien, además de ser profesor en el Programa de Terapia Física en la Marquette University, es editor del JOSPT, un journal especializado en terapia física ortopédica y deportiva de renombre mundial, que es publicado por la Asociación Americana de Terapia Física. Desde los comienzos de su gestión como editor de este journal, su principal interés ha sido el de colaborar con el intercambio internacional de información específica en estas dos especialidades de nuestra profesión. Veamos cómo lo está haciendo.
Well, the strategy we used in starting in 2007 is to really capitalize on the web and the electronic world out there. So starting in 2007, what we tried to do is approach groups of physical therapy, orthopedic and sports group around the world and work with them to provide the journal to their membership, so that this way a group could say we want to provide this as a benefit to our members, and we work with them to provide that on an electronic access at a very low cost, actually. So that's been the primary strategy that we've used. The challenge, I would say, is that for many countries, those groups, those interest groups in orthopedics and sport may exist or may not exist, or if they do exist, the system is not developed enough so as to be effective as far as providing benefits to their members. So I think that's probably one of the things that is of interest to me, is trying to promote further sports and orthopedic groups around the world.
And well, we talk about research with many of the therapists that are attending the AM conference today, and you've been exposed to so much research being the editor-in-chief of JOSPT. How do you see the evolution of our profession in terms of research?
Well, over the last 10 years that I've been the editor, clearly what we're publishing today is so much better than what we were publishing 10 or 12 years ago. I mean, the evolution in the quality of physical therapy research in orthopedic and sports has changed tremendously. It's a lot better than what it used to be. And what is nice is that actually, if anything, the quality of the research has improved, but the clinical relevance of the research is that much further improved. If you look at the journal 10, 12 years ago, a lot of the work was biomechanics or more basic science, and now we have this tremendous influx of research in physical therapy that is very clinically relevant. That's the first thing. The second thing that's exciting is that the research now is coming from all over the world. Back in 2007, we had maybe about 25% of articles that we published coming from outside of the USA. And this year, for the first year, we'll have basically 50% of the work published is coming from outside the United States. So, and that's tremendous, because the idea, if we link that to your first question, the idea is that JOSPT, we want to be one of the journals where research comes from all over the world, and we redistribute it all over the world so that people really get an idea of the research being done.
Absolutely, and one thing that I see is that from a clinical perspective, the journal is being more popular because the clinical implications that you talked about, and that is phenomenal. Do you consider that language is a barrier to access, first of all, as a reader of JOSPT, and the other thing is, is it somewhat intimidating for a non-English speaking researcher to publish in JOSPT?
Yes, let me start with the second part of the question.
Sure.
Because I can relate to both of those questions very well. My native language is French, so I had to learn English, and most of it I learned, you know, like most people, as a second language without having great skills until I came to the United States. So certainly that language is a challenge for the distribution of the journal worldwide. And we get that in some countries. The biggest challenge for them to adopt the journal for their members is basically the language barrier. In terms of research, that is also a real challenge, because manuscripts still need to be written in a high quality of English. We try very hard, I try very hard, and our associate editors try very hard to provide some assistance in that, but at the end of the day, it's very difficult to write the manuscript for an author. So The best strategy is really for these authors to try to secure somebody whose English is their native language and try to help them.
I see. In which way are you assisting?
Well, first of all, is I give these papers a chance. So it'd be too easy to just say, well, the English is not perfect, I reject right up front. So the first thing is to give those papers a chance to go through the review process and try to determine, is the research good enough to be published? Can we overlook the challenge with the writing? And then we try to, if the science looks good and the challenge is really the writing, the first thing we do is try to ask the authors to make an effort to find further help with the writing and provide them some guidance in that way. But I will also spend a lot of time in the final review process, basically extensively copy editing the manuscript. I cannot do that with all papers, obviously, but I will, to the best of my ability, to try to do that for some authors that have good research, and all that needs is a little bit of refining with the English.
I see. Well, you've been lecturing around the world, and do you see that we are pretty much even keel across the world in terms of interpreting evidence base?
That will vary tremendously. I think that what varies is oftentimes that kind of information. People have preference. What I realize in certain parts of the world have preference in terms of the techniques or the kind of the school of thoughts, and I'm assuming that comes a lot from the educational process. Mm-hmm. But I do think that there's different levels of understanding of the current evidence or the current best information out there. Mm-hmm. It seems that every country has people who are very, very knowledgeable about the information. So it depends. I think what varies more is what the general practitioner is aware of. Mm-hmm. And this is, I think, where we're facing issues with language and distribution of information. The people who typically are up to date with information, oftentimes they're instructors or researchers, faculty members, so that's part of their job to do that.
I see. Now, we talked about the evolution of research, or you talk about the evolution of JOSPT itself, and I would like to take that a step further and tell me, how do you see, based on your experience, our profession in 10 years in terms of globalization?
Well, again, if I follow what is happening with our journal, and I see that from 2007 to date, in 2013, we now are distributing the journal to more than 20 groups of physical therapists that specialize in orthopedics and sports. In that same period of about the last 8 or 10 years, we now are publishing 50% of the papers come from around the world. So if I look at the fact that we're gathering information from around the world and redistributing it that way, I think that there's a much better ability now to know what is the science that is being researched around the world, both the science and the clinical skills around the world. Sure. And I like to think that for clinicians, which really what matters for the journal, that hopefully a journal like JOSPT can be like the Sunday newspaper or listen to the news on television, is that you take the journal when it comes every month, and basically you already have a skill set. You know your skill set. You can learn new skills, either evaluation or treatment. And also, what it would be nice is there's also articles in there that hopefully allow you to say, how can I better use the skills I already have? Now, what are those treatment techniques? Are there populations that my treatment techniques would be better for? Techniques that I already know.